I know that in Africa, there are some challenges for healthcare professionals actually accessing, these opportunities for CME CPD. Can you speak to some of the challenges that you've come across, especially with the team of healthcare professionals you work with?
So one of the challenges I would put across is that, as I've indicated, you have knowledge revolving, and we don't have course writers, dedicated course writers who can write these courses for CMEs. These courses need to be updated, reviewed regularly as trends change in the medical practice. So we don't have dedicated people to write these courses. In addition, to administer these courses, populations are growing. The main mode of administering possibly could be through online courses. But then many platforms are just coming up now. Platforms like Zoom, Moodle, Astria are just coming up, and most of them are expensive and not affordable to smaller institutions. So that is one of the challenges. And unless we have maybe somebody who could be dedicated to sponsor these platforms. The other challenge is that of connectivity. Not everybody has got internet. If they have internet, maybe there's a slow bandwidth. So if there can be technology where people can even have recorded lessons and exams, which could cater for people without immediate connectivity, those are some of the issues which could bring out this challenge to resolution.
From what you say, it's really the cost is a problem, access in terms of connectivity to online platforms may be a problem. What about time? What do you think about people who have to go to venues? I mean, talking about things like live conferences, the seminars, where they actually have to go to a location. Will that also be a problem?
Well, if it became mandatory, like for example, our licensure institutions here are trying to make CPD and CMEs mandatory. In terms of time, the health workers will be obliged to find time. They can do it at night. They can do it at any convenient time. They can get permission. So if it's going to the venue, it has to be arranged possibly better for a group. It could be a group session much better than individualized. Mm-hmm. But if it's online, anybody who can manage to access or even recorded courses and exams, that is a possibility.
Yes, that's great. Because where I'm leading with that question is the fact that all Milo Initiative courses are online. And it looks like it is a good option for many healthcare professionals in Africa. Would you agree?
I totally agree, yes.
Okay, that's great. The other thing that Milo is thinking of is an app so that, keeping in mind the problem of immediate access because of bandwidth. The thought process there is that if a healthcare professional is practicing in the village setting and they go to an urban area where there is bandwidth, they can download those courses and then do it at their own time. So we are thinking of an app, and I want to hear from you whether this is also a good idea.
Well, it is a brilliant idea, as I mentioned, that if somebody can have access to a recorded session of learning and being examined, that would be the best way to go. So if you can have an app where somebody can access, do the course, and maybe just find a one-off time to have internet access and submit what they've done, that would be an excellent option.
That's great. It's good to hear.